You bet, you bet. And to get us started, I want to show you a couple of graphics so you can see what's happening with COVID right now. The Delta variant is very different than the other variants that we've seen before. This one spreads much more rapidly, and we're seeing it right here in our own state. On the first slide, you can see some estimated projections for what could happen if we continue to accumulate cases at the same rate that we're accumulating them right now. What we're actually seeing in Alabama is that the southern part of the state is really on a rocket track in terms of adding cases. So what I did is I made 3 different models. I looked at what's going on in southern Alabama and said, what would happen if what's happening down there started happening in the middle of the state and in the northern part of the state? What if we continue to stay on the same path that southern Alabama is on? And that's the really tall dotted line that you see off to the right. The next thing I took a look at is what if we are like India? What if we have the same rate of case growth that India experienced about 3 months ago? Then we'd be on that middle dotted line. And all the way at the bottom dotted line is what if we were on the path that the UK took with Delta, which was a much lower peak. As you can see, the UK had about 70% of their population vaccinated, and they made some changes to social behaviors when they started having a lot of infections due to the Delta variant. So you can see the impact of those 3 different models. The solid line off to the left gives you an idea of what we've experienced already in Alabama. You can see that this Delta peak is different. It doesn't matter whether we're on the India path, the southern Alabama path, or the UK path. We're going to accumulate a lot of cases this time because it spreads so rapidly. This is very different than what we experienced last year. The other thing that we know with this one is that people can develop symptoms even if they've been vaccinated. Typically, those symptoms are very mild, but that means that people that are vaccinated could also spread this particular version of COVID. That's something we didn't account for in early models because we thought that the vaccine would keep people from spreading it from one person to another. This again means that we have to be very diligent in our social behaviors because we know that it's here in the community. We're seeing what's going on in southern Alabama. We're seeing what's happening in Florida. And to put it in perspective, Florida's on even more of a rocket track than what southern Alabama's on currently. So again, we're trying to slow that down so that doesn't happen statewide. The next slide's actually a table. And if you want to take a look at this table, you'll see what the implications are at the peak. When are we going to get to the peak? It occurs at different times depending on how the virus is transmitting. But if we stay on the southern Alabama path, within 2 weeks, in statewide, we'll wind up with 13,000 cases a day. That'll translate to somewhere between 7,800 and 8,000 hospitalizations, which is nearly double what we experienced last January. These are scary numbers. These are much worse than we've seen in the past, and we're really trying to have that not happen. We want to slow the spread of this particular variant so we don't get in a situation where we have 8,000 hospitalizations. But it is very possible with this variant if we don't change our social behaviors. On the very last slide, there's a figure that shows how the model is predicting hospitalizations, whether we're staying on which one of those curves. And you can see there that it looks like we're somewhere between India and southern Alabama. We've started to slow down just slightly, but there are going to be changes in social behaviors around the corner. Schools are starting, universities are starting. People are going to be getting together with other folks that are not in their social circle. So we anticipate that cases will start climbing again, even though they seem to be maybe slowly leveling off a little bit in the last couple of days. And that was all I had for opening remarks. I'll take questions later.
All right. Thank you, Dr. Judd. Dr. Nafziger, go ahead and make your opening comments.
Well, thank you very much. As you can hear from the data that Dr. Judd shared with us and the projections, things are not really looking good for Alabama over the next 2 or 3 weeks. Those are actually some fairly frightening numbers that she shared with us, and definitely has my attention and has the attention of the entire healthcare community. And I really hope it has your attention too. Now, since this pandemic began, all of us in healthcare, we've been really extremely careful not to say anything that would cause the public to panic. And that's the last thing I want to happen right now. I don't want people to panic, and I don't want you to think that you're not going to have health care available to you. I don't want people to be feeling like we're in a dire circumstance if it's not accurate. But I want you to hear me very carefully. We are in a dire circumstance right now, and it's time for people to really take this seriously. The numbers and the outlook does not look good, and I'm going to tell you what that means for us right now. I know Dr. Judd just shared with us the projections, but I'm going to tell you where we are today, here and now, and I hope that it gets your attention. Our healthcare workers right now, you know, if you go through the hospital and look at their faces and talk to them, you know, they're very concerned. They're very worried. They're exhausted. We've been battling this pandemic for a long time now. And, you know, we're just tired, but they're still coming to work and still here to take care of you. But right now, what we're seeing in our hospitals across the state is we're seeing an absolute tidal wave, once again, of patients coming to see us who are infected with COVID, who have terrible symptoms of COVID, and who are requiring treatment and hospital admission for COVID. There are only a finite number of healthcare resources available in this state. And those resources now are having to be directed to care for patients with COVID. And what that means at University Hospital is that we've had to delay procedures and cancel procedures for patients for other very important medical needs. We've had to delay surgeries for cancer, surgeries for transplants, surgeries for all different types of problems, for heart problems, you name it. We've had to cancel people's surgeries or not schedule them when we normally would have been able to do them. And to give you an idea of the magnitude of that, starting next week, we're only going to be able to do a little over half of the normal surgical cases that we normally do because we don't have enough healthcare resources available to take care of what we normally do, plus all of the patients who are coming in needing care for COVID. Not only have we had to limit the number of procedures that we're scheduling, but we're also having to decline transfer requests for patients who normally would come to us for care for specialty services, and they would come from another hospital and come transfer to UAB hospital for specialty care. We're having to decline those transfers and say, I'm sorry, doctor, I cannot help you take care of this patient today. You cannot send them to UAB because we do not have the resources to take care of them. So that's what's going on today. It's time that people really listen and pay attention to what is happening. Our emergency departments are extraordinarily crowded. On a normal day without COVID, our hospital's very full. And many of you know you've gone to the emergency departments and sometimes experienced long waits. Well, they're much longer now than normal. Patients are crowding in the emergency departments. They're well over 100% capacity most mornings. Most mornings at UAB Hospital, we have around 40 patients in the emergency department who are waiting for a hospital bed. So it's just very crowded, and I want you to understand the circumstance that we're facing in healthcare right now. We also have had to make some changes at UAB to account for this crowding and for the surge in COVID cases, and I wanted to make you aware of them also. Beginning on Monday, we're going to have to further limit visitors to the hospital. We've already implemented some restrictions for that in recent weeks. Our emergency departments no longer are able to accommodate visitors other than in compassionate care circumstances. Beginning on Monday, we'll limit hospital visitors to one visitor per patient over the course of 12 hours. And after 12 hours, visitors can rotate out and a new visitor can come in. And that will allow family members to get some rest and rotate in and help take care of their loved one at the bedside. So be really a caregiver and a member of the team at the patient's bedside. Now, we do have some exceptions to this in different patient care areas. For COVID patients, we don't allow visitors unless it's an end-of-life circumstance. That's because we're trying to limit the spread of COVID, and there are other exceptions for specific circumstances. But in general, most patients will only now be allowed one caregiver at the bedside or one visitor, as we traditionally call it, per 12-hour period. So those are some things that we're having to change operationally at the hospital, in addition to limiting the number of services that we can schedule and provide. You know, University Hospital is not unbreakable, and the healthcare system is not unbreakable. And I think that a lot of us have always thought that healthcare would always be there for us. But we're rapidly getting into a position where care for services that we take for granted is not going to be available if we don't turn this thing around. Care for trauma. If your teenager gets in a car wreck, I'd like to know if that happens to my child. I'd like to know that we have trauma surgeons and operating rooms and all the things needed to take care of them available. But rapidly, we're getting into a position where those things may not be available. It's time that we take action to turn this thing around. And I'm going to tell you what, you may say, well, Dr. Knapziger, you're all doom and gloom today. This just sounds terrible. But it's not all doom and gloom, folks. We can turn this thing around if we would just take action right now. And there's some simple things we can do. It's the same things we've been talking about over and over again. Number one is if we put on a mask. I know that a lot of people have talked about masking, they've talked about vaccines, and this has turned into a very political debate. And I'm not here to talk politics with you. The vaccine is not a member of a political party. COVID is not a respecter of your politics. It will infect anyone. This is not about politics. This is not about your views or biases. This is about science. We wouldn't be sitting here telling you that we need you to wear a mask and we need you to take your vaccine if we didn't have the research and the data to show that it really does help and make a difference. So the simple things that we need you to do, it's the same things we've been asking all along. We need you to put a mask on when you go out in public, when you're around other people. We need you to take your vaccine. These vaccines that are available are the miracle that we prayed for when this pandemic began. And we got that miracle. It's here. It's been in the freezer since December. All you have to do is get your vaccine. And if we do those two things, if we mask up, if we get our vaccine, if we socially distance and wash our hands, do the things we've been talking about this whole time, then we can stop this. We can end this thing. I'm an Alabamian. I was born and raised here, and I'm darn proud of it. I love our state. I love the people here. I love UAB, and I love working here. And I wouldn't be telling you these things if I didn't believe them, if I didn't know them to be true. We're going to have to take action now. We've got to stop this thing, and we can do it. It's not too late. We can stop this thing right now if we would all just do our part, love our neighbor, and take care of ourselves. Thank you.
Thank you, Dr. Knapziger. We will go ahead and get started with some questions that have already been submitted. First question is for Dr. Judd. You mentioned how people changing their behavior can help change these curves. Can you talk more on what these changes might be that can help?
Absolutely. The number one thing today that matters is your mask. And I hear you've been vaccinated and you're saying, why do I have to wear a mask? Well, the reality is that this particular version of COVID, you can get a little bit of it in your nose and your mouth, even if you're vaccinated, and you can transmit it to other people. I know for myself, I take care of myself, I work out, I do the things that I have to do to stay healthy. So I think, if I had COVID, it might not be that bad. That actually scares me worse because that means I could give it to somebody else who it is really, really bad for. So when I go to the Piggly Wiggly to get my groceries, when I go to gas stations, when I go to the coffee shop to get my coffee, I'm going to have my mask on to protect those other people in there that might not have the ability to work out and do the things they need to do to stay healthy. Or perhaps they have an immune condition that would make it difficult for them to respond to the virus. I understand that that's a really important thing. For example, in schools, we know that schools last year that used masks and had a mandatory mask mandate, they had a 37% reduction in COVID compared to schools that did not use a mask mandate. 37% is whopping. It may not sound big to those of you out there, but for me, looking at those peaks, a 37% reduction in hospitalizations means it's much easier for the hospital to do their daily operations. The other big thing besides masking, it's the vaccine. The vaccine helps us to not have COVID be as bad. There's fantastic data out of Iceland right now where they're about 90% vaccinated, and they're also experiencing a major surge with Delta, but people aren't winding up in the hospital. It is the bad cold that everyone talks about. Makes them sick, but they're not going to the hospital and they're not dying. So the vaccine, it can help you to really fight this infection so that it's not bad for you, and the mask can keep it from giving it to other people. The mask can also protect you. So if you're wearing an N95 mask and it's got a nice tight seal around your mouth, the mask also will protect you from other people. So those are the two basic things that we can really do right now to push that curve down and get us much closer to the UK curve.
All right, thank you, Dr. Judd. This next, Crystal, I think your first question was just answered, so we'll get to your second one, and I think Dr. Nafziger can answer this one. Is UAB going to open any mass testing or vaccination sites?
So thanks for asking that. That was actually one of the things I was supposed to update you on, and I forgot to. UAB Hospital has continuously operated some testing sites throughout the pandemic, and during the summer months when our cases were very low, we actually pivoted our testing operation to our Kirkland Clinic parking deck so that we could collapse down to a smaller operation. Now that cases are surging back up, we are pivoting that operation starting next week back to our Highlands Hospital parking deck so that we can accommodate more patients being tested on a daily basis. So that will happen next week. As far as mass vaccination sites go, right now UAB has 2 vaccine opportunities available. One is in our Kirkland Clinic on the 2nd floor of that clinic. And then the other one is on the 1st floor of the old Kirkland Clinic parking deck. There's an injection clinic there. And just as a reminder to everyone, those vaccines are free. Don't cost a penny for you to have them. But vaccines are also available at almost any pharmacy in Alabama. They're available widely across our state. So you can get one just about anywhere. Now we are talking about perhaps making some other vaccine offerings. We have some pop-up sites that will be happening around campus over the next few weeks. But stay tuned for more information on that. If we see the demand go up for vaccines, if people really decide, hey, you know what, I am going to get this vaccine, then we may have a mass vaccine site open up if we see the demand really there. But right now, those are our vaccine offerings that are available.
Thank you. Next question will go to Miranda Fulmore with WBHM.
Hey there. Thanks so much. Can you guys hear me okay?
Yep.
Okay, great. So I just wanted to follow up, coming up this weekend is the Rock the South concert over in Coleman, and then we have Trump's visit coming up at the end of the month. Do you think that those events could escalate us to closer to that trajectory that you're talking about, Dr. Judd? And, I guess how is UAB Hospital preparing for possible maybe super spreaders? I don't know if that's the correct word to use. Just looking for some insight on that. Thanks.
Those type of events are definitely going to lead to transmission. If you're at an event that has more than 25 people, there's a 50% chance somebody there has COVID. If you're at a big event that has 100 people, you're guaranteed that somebody has COVID. So it would be very possible for transmission to spike after one of those events. And we could stay on that path that we're on. I think that's one of the things we saw down there in southern Alabama and Florida. It was the summer. People were going to the beach. They were going out to eat. They're doing all the things that we had hoped to get back to. And we're seeing lots of transmission in those settings. So yeah, absolutely. Those events, even if they're outdoors, it's quite possible that we could see a lot of cases.
And I'd be happy to answer the portion of that question about what is the hospital doing to prepare for these super spreader events. I mean, we're definitely worried that these could turn into super spreader events. And we've talked about in the past, I believe, we've been concerned about different events and worried that they would be super spreader events, where a lot of people were infected at the event. And some of those have ended up being spreader events and some haven't. The thing that's different now is Delta. Delta is so much more contagious. And so we definitely are worried about mass gathering events where people could transmit the virus. And so what are we doing to prepare for it? It's the same things that we are already doing. We are looking daily at, trying to adjust how much elective work we can do and also still maintain bed availability for our COVID cases that are coming in, the patients who are infected with COVID. And every day we've essentially dialed back more and more of our elective cases. So we're not able to schedule as much each day. And we're having to turn more and more beds from regular patient care into COVID care. And so we have a plan laid out about which units, which nursing units we successively flip over. We call it flipping it to COVID care from regular patient care. So that's something that we're doing at the hospital. And then, the other thing we're doing at the hospital is thinking worst case scenario. That's something that we're really trying to think ahead. What if this really gets into one of those events that we're concerned about? If you saw the projections that Dr. Judd shared, and I've seen projections from many other epidemiologists, and if we truly end up with a number of COVID cases that are projected in 2 to 3 weeks, then that means our hospitals are not going to have enough beds to care for these patients. Even if we stop doing everything else, we're just not going to have enough beds. If we get into that circumstance, we're going to have to think about where can we care for these patients safely and looking at alternative care sites. So, even thinking about, gosh, is there conference room spaces? Are there other areas where we normally don't care for patients where we could put a stretcher and some nursing staff and some physician staff and all the other support services and care for more patients? We're looking at hallway spaces. We've already converted our waiting rooms of our emergency departments into patient care areas. I mean, these are the things that some of them are already happening right now. And it sounds horrible to even say it. Like, I hate to even talk about these things happening, but that's what's happening. That's the reality of the circumstance that we're in. So, I hope that gets everyone's attention when you think about that, when you think about running out of hospital beds and running out of healthcare resources. That is the path that we're on, and it's very alarming.
Thank you. And Dr. Nafziger, you mentioned just to clarify something about the vaccine and testing clinics. Are those for the general public, or are they for UAB patients only?
Oh, that's a great question. Our vaccine clinics are open to anyone and everyone. You are more than welcome to come, whether you're a UAB patient or not. We're more than happy to provide vaccination to you. And then as far as our testing sites, those are available by appointment, but you don't have to be a UAB patient to receive a test at UAB. You can call our COVID call center and we can get you scheduled for testing. You do not have to be a UAB patient to receive a vaccine or a test.
Right, thank you. Dr. Judd, this question comes from Chip Scarborough with NBC 13. Is our state prepared to potentially handle almost 8,000 hospitalizations statewide?
I think that's actually a better question for Dr. Nafziger to talk about the hospitalizations.
So, that's a great question. And I'll tell you, we are at UAB Hospital, our leadership team is in constant communication with the Alabama Hospital Association leadership, as well as the leaders of other hospitals in our area. And I can tell you that no, we are not. If we get into that circumstance, the hospitals in Alabama are not prepared for that. As much as I'd like to say that we are, our hospitals have a breaking point. We have a lot of healthcare resources in this state, but they are not infinite. We are breakable. So if we get to that point, then no, we do not have enough resources to take care of that much. And, a lot of people will say, well, why can't you just call for help? Why don't we just bring in the National Guard? Just call for help, set up a tent hospital. Well, we've been talking about how we have a shortage of healthcare workers, nurses in particular. We just don't have enough nurses already to work. So, that's all great. But, if you set up a tent hospital, who's going to work there? We don't have enough healthcare workers already. We're in a shortage situation. So, we could set up a tent hospital, but how are we going to man that? How are we going to staff that? You could call in the National Guard, but, if you think about who's in the National Guard, a lot of them are healthcare workers who already work in our hospitals. So it really, would take away from the resources that are already there. So I don't think we do have that tremendous surge capacity. I would love to say that we do, but I just don't think it exists right now.
All right, thank you. This next question comes from Sarah with AL.com. Dr. Nafziger, when do you anticipate, if you can, the hospital running out of capacity for people with non-COVID needs, given the current trajectory?
Well, I would love to have a crystal ball and be able to tell you exactly when that point would be, and I'd love to say never. I couldn't tell you an exact time because what's happening right now is we're still providing emergency care. So patients are coming in, today we've had patients come in with major trauma, with heart attacks, with strokes, with other medical emergencies, and we're still providing that emergency care. The thing that we've stopped is care for other healthcare conditions that may not be an emergency today, but if they don't get care, it's going to turn into an emergency at some point. So, surgeries for heart disease, surgeries for cancer, transplants, a lot of those type of things are the things that we're delaying. So those are the type of things that we've curtailed. I hope that we never get to the point where we don't have emergency services available, but we are tiptoeing closer and closer to that line. When are we going to get there? And are we going to get there? I don't know. There's no way that we can predict it, but I do know that we can help do our part to stop this thing and not get there if we can all put on our mask and get our vaccine. Those are the things we need people to do. I can't tell you an exact time, but I can tell you if these projections are true, that are seeming right now, we've really been following the projection lines. And if this comes to pass, we're going to get to that point where those emergency services, where they're just not available either.
All right, thank you. One more question from Sarah, and then we'll pivot back to Dr. Judd. But Dr. Nafziger, can you talk about current staffing levels? Are there employees out with COVID? If in a worst case scenario, will there be enough staff? If not, what does that mean for patients?
Staffing is something that we struggle with every day at the hospital. And it's not just nurse staffing. We've struggled to maintain staffing in a lot of different areas, environmental services, guest services, food and nutrition services, a lot of the support staff that are so critical to us being able to provide health care. Healthcare is a team effort. It's not just doctors. It's not just nurses. There are a lot of people who work together to provide your health care. And we've been struggling to keep enough people there. It's no shortage that every industry just about has suffered from workforce shortages and labor shortages. And, healthcare is no exception. So lately, we've been struggling just like everybody else to make sure that we have enough staff to provide the health care that's so desperately needed. But we have more and more staff now who've been affected personally with COVID. We do have employees who are out with COVID, and some of them are people who've been vaccinated, and I'm going to talk to you about that a little bit. But yeah, we do have a lot of staff who are out with COVID now. I think this morning the count was up around 140, 150 UAB employees who are out with active cases of COVID who cannot come to work because they're having to isolate at home and be cared for with COVID. So definitely it's impacted our staffing. Now, we do have a lot of staff who, I told you I was going to talk about this, and somebody's probably going to ask me this question, so I'm going to go ahead and talk about people who have breakthrough cases. A lot of people say, why would I get this vaccine if I can still catch COVID? I mean, that doesn't make any sense to me. Well, here's the thing. The point of the vaccine is to prevent death and disability. It's to keep you from having severe illness. It doesn't perfectly protect you from having COVID again. So you can still catch it again. We know that. But what we're seeing is the people who are vaccinated who later catch COVID, their case is very mild. They have a cold. It takes this killer disease and turns it into a cold. And I think one of the most compelling numbers that's really important, I don't like saying numbers a lot, but one of the most compelling numbers to me is if you look at the people who are in the hospital with COVID right now. And at UAB, 91% of the patients today, if you look at the numbers, 91% of the people who are hospitalized at UAB with COVID didn't get their vaccine. So the people who got their vaccine, by and large, are not ending up in the hospital, and they're not dying. And that's the most important thing that we need to stay focused on. Yeah, you can catch COVID, but it's just a little cold. Can you still transmit it to other people? Yes, absolutely. And that's why the masking is so important right now. And that's why it's so important for us to get everyone vaccinated. We're trying to prevent people from dying, y'all. I mean, I don't know how to be more direct and blunt. I don't want people to panic, but I also don't want people to die. I don't want people to have the long-term effects of COVID. And I don't want people to die because our hospital is so full of patients with COVID that we can't take care of your heart attack or your car wreck or your stroke or some other thing. That's really what it's all about, is about saving lives. And that's why we're here talking to you about this today.
All right, thank you, Dr. Nafziger. Dr. Judd, your models and projections show numbers for overall COVID cases and hospitalizations. Can you speak more on how these numbers don't necessarily take into account the level of absenteeism Alabama will see with people having to miss school or work due to quarantine?
Yeah, absolutely. To me, that's also one of the very scary factors about this next surge. If we really hit that peak, if we stay on the Southern Alabama trajectory and we wind up at that peak of 13,000 cases per day, that means 1 in 4 Alabamans will be sick with COVID on a given day. 1 in 4. I don't mean just a little sick. These are the people that are actually sick and need to be home, can't go to work, having a difficult time breathing. That's a lot of folks to not be able to do their job. On top of that, there will be about 5 people for every one of them that were exposed, because we know from the previous surge that that's about how many contacts each person has. So that means that 20% of our state will be in quarantine or ill during that time. 20% of the people that are at the gas station that you go to, 20% of the people that work at the restaurant that you go to, that work in your child's school, that work in your office will have to be home either due to quarantine or because they're actively sick. That's a lot. When Sarah was talking about the hospital transport and talking about all the services the hospital provides, think about the ambulance drivers. That's a lot. 20% of them may be out with COVID. Absenteeism will be something we've never experienced in this pandemic before. It's the thing that everyone feared at first. It's why everybody ran out and got toilet paper, because we thought the supply chain was going to be interrupted. This time you'll see interruptions in the supply chain. You'll see where we just don't have enough people to do the basic jobs we have during the peak. Again, I don't mean to be doom and gloom, similar to Dr. Nafziger, but it's just where we are right now. It's the path we're on. We're on a path that puts us in a very different place. Talk to your parents, talk to your grandparents, ask them what measles was like 40 years ago. Ask them what people did. We're so used to in this country not having to deal with major infectious diseases because we've done such a great job with our vaccine campaigns at getting rid of things like measles and smallpox, at keeping the water clean so we don't have cholera. But ask people who lived through that what that was like. When there was a measles outbreak, they didn't race off to send their children to school. They didn't go out in public for things that were unnecessary. They took precautions to not come in contact with the virus. This is one of those that you want to take those precautions. And we know the precautions. We know the masking. We know the vaccine. We've got ways to fight it. And so that's the biggest thing. We need to make sure that we've got people out there, you're getting your vaccine, you're wearing your mask, and we don't have to be at that 13,000 per day, which is what leads to the 20% of the workforce being out.
Thank you. Another question, Dr. Judd. You said that we're between the India and South Alabama models. What's the current projection based on where we are today in terms of hospitalizations, cases, and deaths for the peak? And what are the limits and challenges of modeling this current COVID surge?
The limits and challenges of modeling, they're vast, because you're trying to predict human behavior. And it could be that after folks hear what we have to say today, they say, okay, I don't like the mask, and I don't want to get a shot, but I'm going to go do it. And that would change all of my models in a great direction. It could also be that people go out and go to big concerts or have an event where they get together and it spreads it in a different direction. So certainly there are limitations to the models. We seem to be following that middle path. That's one of the reasons that I regularly check. Right now, I'm daily checking the model to see if it's fitting with what's predicted. The thing that I'm watching to see if we stay kind of in that middle of India and Southern Alabama or move back up to the Southern Alabama path is school starting. That's the big event when kids get together. Children have very different hygiene behaviors than adults do. It's just a natural thing. How often do you have to tell your child, cover your mouth when you sneeze or cover your mouth when you cough? It's just, that's the way kids are. and they're going to be back in school together, coughing and sneezing and not sure if they have COVID or don't have COVID, or is it allergies? So I'm going to send my kid to school. That's very normal for human behavior. And so for me, that's what I'm watching in the next 2 weeks. I'm going to really be watching these cases that might occur as schools restart, as universities reopen. Again, that's a different set of social behaviors than those K-12 students. University students are either getting back together with friends they haven't seen in a long time or meeting brand new friends. But again, it's a high transmission setting. They're close together. They live close together. They have social behaviors that make them more at risk in terms of eating together, sharing beverages, sharing meals. So again, those are the things I'm watching in the models to see if we wind up ticking back up to the southern Alabama curve. The southern part of the state, Mobile, Baldwin County, and Florida in particular have not slowed down yet. So that's the other thing I watch, is that rate that's going on down there. Is it going to push up into Jefferson County? It matters. Jefferson County has more people than Mobile County has. So if Jefferson County starts to experience that same rate of case explosion that Mobile is experiencing, it's going to be really challenging for our hospital resources. In general, it looks like we're going to peak somewhere around the beginning of September to the middle of September, depending on which path we're on. We peak a little bit earlier if we wind up going up the mountain really quickly, which is exactly what we don't want to do. So that's what we're watching. Like I said, I check it every day to see where we are. I'm in close contact with Dr. Knapsinger to let her know how we're accumulating cases and how it's relating to hospitalizations.
All right, we've got time for 2 more questions that were already submitted, and they're both for Dr. Knapsinger. Has UAB Hospital reached out for additional healthcare providers, whether it's from UAB School of Nursing, National Guard, or anywhere else? And will UAB Hospital or others have to do this if they aren't already?
So one of the things that I love about being here in Alabama is people are very helpful. People volunteer, and they'll definitely pitch in when times are tough. And we've seen that throughout this pandemic, particularly with our mass vaccination efforts. We had a lot of volunteerism from our School of Nursing, our School of Dentistry, School of Optometry, School of Medicine, all the different healthcare professions programs on the campus of UAB all pitched in to help make our mass vaccine sites work. And I know a lot of other healthcare providers have shared stories with me about that. We did have, during the course of this pandemic, we've had retired healthcare providers come back and help us with specific things. And we're starting to see some of that happen again. So definitely we've reached out to some of these individuals who we're able to, where we can get them credentialed, where we can still play by the rules, if you will, as far as licensure and regulatory bodies go. We have used a lot of volunteers in those aspects. So I anticipate that if this surge continues, that's something we'll continue to do, and we may have other opportunities for volunteerism. So definitely stay tuned for that. This is something that we've all talked about. We want our state to be open for business, and I've heard that statement said a lot. And you know what? Nobody wants that more than me. I really want our state open for business. I feel for the small business owners who really suffered and shut down, and for the people who lost their jobs and lost their livelihoods. I can't imagine how horrible that must be. And I think one of the most important priorities for all of us is keeping our state open for business. And I think the way that we do that safely is do the things we're saying. Wear a mask, get your vaccine. If we can do those things, we can stay open for business safely. And I think that's what we all want.
All right. And last question is for you. How difficult is it right now in UAB's emergency departments? I know UAB Hospital is a safety net for the community and state because of the highly specialized care it can provide and its role as a level 1 trauma center. Can you talk about that, please?
Yeah, I'd love to. My favorite place in the world is the emergency departments at UAB, where I've spent 20 years of my career, and they're really special places. We've saved a lot of lives there, and I really love those places. I love the people who work there, the doctors, the nurses, the techs, all the staff there. They are incredible people who bring just an extraordinary skill set to the table, and they perform miracles every single day. What I'm seeing there now with them as they have patients, who are kind of overloading the emergency departments. We have more patients than we have beds. And that's the case a lot of times. People come to the ER and have to wait a while, especially if they have something that's not immediately life-threatening. And I think most people understand that because we take care of the sickest first. The emergency that, if we don't do something right now, it could take your life. Those are the people that we take care of first and immediately. And so I think people understand sometimes there's a wait. But right now the wait times are longer than they've ever been. And we have more patients than we've ever had who are waiting for care, waiting for a hospital bed. And those things are very disturbing to our staff. It's hard on them. They're very tired. They're exhausted emotionally. They're spent in a lot of ways, and they're having to really dig deep right now to find that energy to come to work. And somehow they're doing it. Somehow these folks who are just amazing people, they're digging deep and coming into work every day with a smile and with professionalism, and they're still performing those everyday miracles that they do in that emergency department. So it's a tough place to be right now with wearing all the personal protective equipment that we have to wear, all the masks. It's hot, it's stifling. It's a tough environment to work in right now. So I think it's important for people to understand what a strain this is putting on the healthcare providers. And these folks are just coming in day after day, wearing a smile and taking care of business and doing what they do. But yeah, it's a tough environment to work in.
All right. Thank you, Dr. Nafziger, and thank you, Dr. Judd, for taking time to address the media today.